Hey students, it's Dr. Ways, and welcome to your lecture on the face. The information within this lecture is pulled from your bare bones workbook, so if you don't want to follow along on a lecture PowerPoint, you could follow along in the bare bones workbook and get the same information. So all the pictures that you see here and all of the information that you see in these boxes are pulled from that book. These pictures right here are pulled from your Gray's Anatomy for Students book from Clinical Key. So the first muscle to come over is the one we've already covered previously when we talked about the scalp, and that is the occipital frontalis muscle. Sometimes you'll see it called the epicranius, then frontalis, if it's talking about this muscle, or occipitalis if it's talking about this muscle. All right, again, like usual, the origin and insertion I'm not going to hold you responsible for, but I will talk about them in some regard just to explain how they work. All right, but you do need to know the action, and you are responsible for the innervation. What you're going to see is that most of the muscles of facial expression are going to be supplied by cranial nerve 7, the facial nerve. So reminding you that between the frontalis and the occipitalis, we have this epicranial aponeurosis, which is one of the layers of the scalp. And when the frontalis or occipitalis contract, actually, let's go back. When the frontalis contracts, its job is to either draw the scalp anteriorly using the aponeurosis to raise our eyebrows. So pulling this way, it's going to raise the eyebrows up, and also it will wrinkle the skin of the forehead. The occipitalis, on the other hand, is going to pull on the aponeurosis, and what it's going to do is it's going to draw the scalp posteriorly, but as it's doing that, it's also going to raise the eyebrows. So even though that's not specifically stated here, it will raise the eyebrows as well. And you can experiment with this on yourself. Like, put your hands on the back of your head about where the occipitalis is located. So on left and right sides, about the level of the ear, and then raise your eyebrows a few times, and you can actually feel that muscle back there contracting, highlighting that it does have that function of raising the eyebrows. And if you put your hands on top of your head when you raise the eyebrows, you can feel the aponeurosis moving as well. All right, so all of these pictures right here that you'll see from your bare bones workbook will show you what the actions of the muscles are. If I couldn't pull something from the bare bones workbook, I added my own picture. The next muscle is the Orbicularis Oculi. So it's this circular muscle that's surrounding the eyeball, and there are two parts to it: the orbital part, which is going to be the circular, and the palpebral part, which is going to be on either side of the palpebral fissure. And this muscle, again, innervated by the facial nerve, its action is to close the eye. So when you contract these muscles, the eye is going to close. And so this is what we would see with the palpebral portion. Notice that it looks like a relaxed closure of the eye, and this is with the orbital portion, so you notice that's more of a tight close. All right, the zygomaticus major and zygomaticus minor, named so because they attach to the zygomatic bone, but then they're also attached to the corner of the lips. And so when you pull on those muscles, the zygomatic bone is not going to go anywhere, but the lip is. And when the lips move up, what do? We smile. So these are going to be your smiling muscles, specifically drawing the angle of the mouth superior and laterally, which is what we call smiling. The next muscle is called the Buccinator or Buccinator. I've heard it pronounced both ways. Both would be adequately correct. And those are muscles within your cheek on either side. Again, they are supplied by facial nerve, cranial nerve 7, and their job is when they contract, they press the cheeks against the lips and teeth to produce motions such as sucking, blowing, whistling. Here we see the zygomaticus muscles in action with a sucking motion, and here we see the zygomaticus muscles is in a blowing motion. So when it does this, you're going to see the corners of the mouth drawn laterally. All right, so the corners are going to come this way a little bit as we're sucking. And another function of it is to keep the food between the teeth. So we contract that muscle and the food is kept between the teeth so that we can chew it adequately. All right, next we have the Orbicularis Oris. So we've already had an Orbicularis muscle, and those were with the eyes. And oculi refers to eyes, oris refers to mouth. So Orbicularis oris would be surrounding the mouth. Again, cranial nerve 7, the facial nerve, and its job when contracting is it will like putting a rubber band around the lips. So it's going to close the lips, it's going to protrude them, and give us like this kissy face kind of appearance. All right, so it'll compress the lips against the teeth and shape lips during speech. So when we're talking, especially if we're making sounds like P, this will be a very important muscle for that. The next muscle is the Levator Labii Superioris, and that is this muscle right here at the inferior border of the Orbicularis Oculi and at the superior border of the Orbicularis Oris. Again, facial nerve, cranial nerve 7. Its job is to elevate the upper lip, and so when you elevate the upper lip, this is the kind of motion it makes. So, you know, Elvis was known for his kind of snarl, so that is obviously has a very healthy Levator Labii Superioris muscle. The next muscle is the Depressor Labii Inferioris. So that's this muscle right here that I'm highlighting in black. And notice that that is going at an oblique angle from the mandible to the skin of the lower lip. So when it contracts, what it's going to do is it's going to depress the lower lip. So if you've got it on both sides, you're going to draw the lower lip down. And so this is what that might look like. So here's the muscles. Here's the lips in a resting position. We contract the Depressor Labii Inferioris, and we pull our lower lip down, and that's what it looks like. Kind of like, almost looks like an angry face, baring our teeth. But if you think about all of the motions that would be required to produce words during speech, this would be a very important speech muscle. Again, supplied by cranial nerve 7. All right, if you haven't figured out by now, many of the muscles of facial expression are named according to actually where they are or what they do. So if you pay attention to the name, you get a pretty good guess as to what the function of the muscle is and maybe where it's located. So a depressor says something's going down. Anguli means that it would be going at an angle, and oris tells you at the mouth. So it would be at an angle of taking the angle of the mouth downward. All right, so here we see the Depressor Anguli oris. Okay, it's going from the mandible to the corner of the mouth, so that's exactly where the name tells you it's going. And what it's going to do is it's going to take the angle of the mouth and draw it downwards, so kind of making a sad face. Okay. The next muscle is the mentalis. All right, again, that's a muscle that tells you exactly where it's located. So where's our mental region? Don't look at your head, look at your chin. The chin is the mental region. All right, so it's these two muscles on the anterior portion of your mandible, and so they're attached to the mandible as well as the skin of the chin, and what it's going to do is protrude our lower lips and pull the skin of the chin up. So you see the skin of the chin being pulled up right here and our lip being pulled down. So that's going to give us a kind of pouty face. So the Mentalis is responsible for giving us a pouty face. All right, we've already covered the Platysma elsewhere, but here it is also responsible for muscles of facial expression. And remember, that is a very thin, very superficial muscle within the fascia over the deltoid and pectoralis major, going up to the mandible, again supplied by the facial nerve. And what it's going to do is it's going to not just affect our neck, but it's going to draw our lip down inferiorly and posteriorly like this, along with the Mentalis, and give us another pouty face. And very weakly it can depress the mandible, but that's not going to be as powerful of a depressor as other muscles that we will that are used. All right, the Risorius is a little bit weird of a muscle, which actually means laughing muscle. So if you notice where it's located, the fascia over the over the parotid gland to the skin at the angle of the mouth. So it's going to the angle of the mouth, and it's going to draw the angle of the mouth out this way to produce a tense look. And so you see the angle of the mouth being drawn laterally to give you like this tense look, or what it looks like to me is somebody who's sitting there listening to your story and going, mm-hmm. So think about that when you think about the Risorius, despite the fact that it's called the laughing muscle. But now thinking about it, I guess if you were to give one of those smiles where you don't actually curve your lips upward, you would be using a Risorius muscle for that. All right, the next muscle is called the Corrugator supercilii, and that's a really small muscle located between the superciliary arch of the frontal bone, which is right here, and the skin of the eyebrow over here. And what it's going to do when stimulated by, again, cranial nerve 7 is to draw the eyebrow inferiorly. So it's going to draw the eyebrow down and medial, all right, and also wrinkle the skin of your forehead because of where it's located, as in a frowning look. So this is the look you have when you are using this Corrugator supercilii muscle. To me, it looks like a WTF muscle. Like, WTF are you talking about? All right, the next muscle is the Levator Palpabrace Superioris, and we have already talked about this when we went over the eye. Remember, that is this muscle up here above the eyeball. It's one of, we consider it to be one of the extrinsic eye muscles attached to the palpabrae, so the eyelid. And when you contract this muscle, you open the eye. You open the upper eyelid, which opens the eye and lets light come in. All right. Unlike the other muscles that we have been talking about, this is supplied by the oculomotor nerve, which is cranial nerve 3. So this is one of the ones that's a little bit different. All right, the next muscle is the masseter muscle, and this is a big chewing muscle. There are two parts. There's a deep part and a superficial part. And you notice that it's attached to the zygomatic bone as well as to the ramus of the mandible. And when you contract it, it basically elevates the mandible. And when you elevate the mandible, you close your mouth. All right, because of the angle it is, it's also responsible for retracting the mandible. All right, again, this is going to be a weird one because its innervation is going to come from the mandibular division, or V3, of the trigeminal nerve, or cranial nerve 5. All right, the next muscle is the temporalis. And the temporalis, if you clench your jaw and put your hands on your temples, which would be your where your parietal bone is or your temporal bone is, and clench your jaw, you can feel that muscle contract. So its origin is going to be the temporal and the frontal bone, as well as the parietal bone here. And it's going to connect to the coronoid process of the mandible. So when you contract this, it's going to elevate the mandible again. So it's going to be responsible for closing the mouth. And again, because of its angle, it's going to retract the mandible. Like the masseter, supplied by the mandibular vision of cranial nerve 5, or the trigeminal nerve. So the next is the nasalis, and again, the name tells you exactly where it's located, on the nose. So if you look at its location, what it's going to do when it contracts, it's not going to do anything to the dorsum of the nose. So it's going to be take the ala of the nose and draw the ala towards the septum. So draw the ala towards the septum this way. So that's going to be kind of like a flaring of our nose, or what we refer to as nasal flaring. It can also cause wrinkling of the nose. So when you have a wrinkling of your nose, like making a face like something is kind of like a disgusting smell, the nasalis is responsible for that as well. Notice here also that we're back to being innervated by the facial nerve. So the procerus muscle is right here at the bridge of the nose, and it extends upward into the glabella, and it's kind of a triangular shape muscle, and again supplied by facial nerve, cranial nerve 7, and its action is that it's going to draw down the eyebrows medially and wrinkle the skin over the bridge of the nose to give you kind of this angry or confused look. So these next few slides are just to remind you about the innervation that's going to the muscles of the face. So one of the sources of innervation is coming from the trigeminal nerve, and as we've talked about it, it's going to be V3, or the mandibular nerve, that's going to go down and up and supply the temporalis muscle with innervation, as well as the masseter with innervation. All right, so those are going to be the only two muscles that we've talked about that are supplied by the trigeminal nerve. But keep in mind that the trigeminal nerve also has cutaneous innervation. So that mandibular nerve, even though it supplies the temporalis and the masseter, it also supplies cutaneous innervation to this region right here. The maxillary division would supply cutaneous innervation to this region. In fact, we'll do that in blue, to this region. And the ophthalmic nerve, the first division, will supply cutaneous innervation to this area right here. Whereas the rest will be supplied by the dermatomes that we talked about coming from spinal nerves. All right, remember the facial nerve innervates most of the muscles of the face, so you see it coming out of here from the external acoustic meatus, underneath the external acoustic meatus, and then branching out to the mandible, the maxilla, to the nasal region, as well as to the orbital and forehead region, to supply the muscles that are located in those areas with a nerve supply. And remember, the sensory branch of the facial nerve supplies the anterior 2/3 of the tongue with the ability to taste. Blood supply to the muscles of facial expression come from branches that are off of the external carotid artery. Remember, it's the external carotid artery that supplies most of the blood supply to the anterior portion of the head and face. Venous drainage happens, I don't care that you know the different veins that go along, but if you notice, they follow along with the arteries, and then they are going to drain into both the external jugular vein as well as the internal jugular vein. And as far as the lymphatics go, there are lymph nodes all over your facial region. All right, so what I did right here is I put a picture, two pictures, one that I found and one that comes from your Gray's Anatomy for Students books, to show you all of the lymph nodes that you are going to be responsible for finding and palpating when you get to your physical exam lab. So make sure that, and I think this is the third time you've heard this now, you're familiar with all of these lymph nodes, where they're located. Practice, you may not feel them, but practice finding where their locations are on yourself so that when you get to this part of physical exam lab, you're ready for it.